On 31st December, during the events prepared to usher in the new year, a number of churches organized blood donation drives. The move has been prompted by a drop in the supply of blood needed by blood banks to support health facilities in the treatment of severely injured patients.
Our main base of blood donors is currently out of school. The students are for their holidays, and it's quite challenging to find them in the community. We found it prudent that we must participate in a blood donation activity that would help us replenish our blood stocks.
The blood transfusion unit every month collects at least 20,000 units of blood in a month. Once blood is collected, it stays for about 21 days. Beyond that, it loses its viability. So blood which was collected in November when children were still in school, by now the viability has dropped down.
Samuel Davis Wante, the blood collection clinical team leader at Nakasero Blood Bank, says because the number of donors drastically went down, the country is facing a situation that can precipitate blood shortage in hospitals and health centers.
As I speak right now, the blood stocks at Blood Bank are going down. So far we've realized 60 units, and we believe by the end of the day we would have realized our target of 200 units of blood.
We have had a massive increase of need of blood from the accidents which we have been having. By the time this was happening, by Christmas, the stores, the blood in the different blood banks around the country had run very low. So much so that we were literally on the border of rationing, even blood.
Dr. Richard Idro, a consultant pediatrician and former president of the Uganda Medical Association, says besides the regional blood banks, there are several collection points where one can donate blood.
In Kampala, the Nakasero Blood Bank has been targeting the population, areas where people are gathering in large numbers. And then the hospitals, because in almost all the hospitals we have a small collection unit. Even the minor hospitals, they are able to collect blood for the blood banks. And the Uganda Blood Transfusion Service also works a lot with the Uganda Red Cross. So wherever you see these centers, they are collecting blood.
With a population of over 40 million, Uganda needs over 400,000 units of blood every year. Gillian Nantume, NTV Tonight.